Have you ever had the feeling that something in your body just isn't quite right, but you couldn't quite put your finger on it? What if I told you that your prostate could be silently changing, and you might not feel a thing until it's further along? Every day, men over 60 are diagnosed with prostate cancer much later than we'd like. This often isn't because they ignored warning signs, but because they weren't aware of what those warning signs look like. I'm Dr. Greene, and I'm a urologist with many years of experience focusing on men's health. I've sat down with countless patients just like you, husbands, fathers, grandfathers, who initially thought what they were experiencing was just a normal part of aging. Then, they discovered they were facing one of the most serious, yet often preventable diseases in men, prostate cancer. The truth is, this cancer often presents itself as harmless changes. Perhaps some slight urinary issues, a little fatigue, a dip in your energy, or even some mild discomfort. But these aren't just random occurrences, they're your body's way of trying to alert you. In this video, I'm going to walk you through 8 of the most important symptoms of prostate cancer that many men tend to overlook until it's too late. These aren't rare or unusual medical situations. They are real, common, and surprisingly easy to dismiss. And at the end, I'll share the most crucial step you can take today to protect your prostate and your overall health. So please stay with me. This could be the reminder your health has been waiting for. Before we get started, if you haven't already, I encourage you to subscribe and turn on notifications so you never miss an important health update designed specifically for men like you. And if this video resonates with you in any way, please type 1 in the comments. If it doesn't, type 0. Your feedback helps me tailor this content to be even more helpful for you. Let's begin with the very first symptom, one that often goes unnoticed because it feels so commonplace. But for men over 60, it could be the earliest and most important warning your prostate is sending. I'm talking about frequent urination, especially during the night. Here's what you need to know. Symptom number 1, you're urinating more often, especially at night. For many men over 60, waking up once or twice during the night to urinate might seem perfectly normal, just another aspect of getting older. But when it increases to 3, 4, or even 5 times a night, it's time to take notice. Frequent nighttime urination, also known as nocturia, is one of the earliest and most often overlooked signs that something could be seriously affecting your prostate. Here's what's happening behind the scenes. As the prostate begins to enlarge, whether due to benign prostatic hyperplasia or the early stages of cancer, it starts pressing against the urethra, the small tube that carries urine out of the body. This added pressure makes it more difficult to fully empty the bladder. As a result, even after you've just gone to the bathroom, your bladder signals your brain again, waking you up repeatedly throughout the night. But it's not just about inconvenience or sleep loss. That constant interruption to your rest can lead to memory issues, daytime fatigue, increased blood pressure, and even a weakened immune system. More importantly, it's your body trying to tell you that your prostate is struggling and possibly signaling the early development of cancerous cells. Far too many men assume this is simply a part of aging and never mention it to their doctor. But ignoring it could mean missing the critical window where prostate cancer is still very treatable. So, if you found yourself making more nighttime trips to the bathroom lately, don't just chalk it up to coincidence. There might be more to the story. And the next symptom might surprise you even more because it's something you can actually see every single day. Symptom number 2, a weak or interrupted urine stream. Now, let's talk about something that many men experience, but few ever mention: having a weak or interrupted urine stream. You step up to the toilet, and it takes a while to get started. The flow feels slow, uneven, or it even stops and starts midway. Maybe you're standing there longer than you used to, waiting for your bladder to empty. You might think it's just a minor annoyance or a sign that your body is slowing down, but in reality, it could be one of the earliest clues that your prostate is under pressure literally. As the prostate begins to grow, whether from natural aging, inflammation, or developing cancer, it can start to squeeze the urethra. This narrowing of the pathway makes it harder for urine to pass through freely.
Imagine stepping on a garden hose.
The water still comes out, but it's no longer a steady flow. It's weak, inconsistent, and frustrating. That's exactly what happens with your urine stream when your prostate is enlarged or affected by cancer cells. What makes this symptom especially concerning is how easily it can be dismissed. Many men attribute it to dehydration or assume they just need to drink more water. But when the stream becomes noticeably weaker, or you find yourself straining to push urine out, it's a red flag. And when left unchecked, it can lead to bladder problems, infections, or worse, a delayed diagnosis of prostate cancer. So, if you've noticed changes in the way you urinate, especially if it's getting weaker or more interrupted, it's time to pay attention. But as we move forward, I want you to stay alert because the next symptom is one that not only disrupts your comfort, it can strike at the most private moments. Symptom number 3. Pain or burning during urination or ejaculation. This next symptom is one that many men find difficult to talk about. Pain or burning during urination or ejaculation. It's uncomfortable, it's personal, and for some, it's even embarrassing. But let me tell you this, if you're feeling a burning sensation when you go to the bathroom or during sexual activity, it's not something you should ignore or simply chalk up to aging. When the prostate becomes inflamed, irritated, or affected by cancerous cells, the tissues around it can become sensitive and reactive. That irritation can trigger pain as urine or semen passes through the affected area. Sometimes this is caused by a simple infection. But in men over 60, persistent pain or burning, especially if it comes and goes or gets worse over time, could signal something more serious developing within the prostate. Here's what's tricky. Prostate cancer doesn't always cause this symptom early on. But when it does, it's often because the tumor has begun to affect nearby nerves or the surrounding tissues. You might also notice this symptom paired with other subtle changes: reduced force of ejaculation, discomfort deep in the pelvis, or general soreness that won't go away. Many men delay mentioning this to their doctor, hoping it will go away on its own. But pain, especially in these areas, is never something to take lightly. The body is sending a very clear signal that something is wrong. If you've felt this kind of discomfort, even if only occasionally, it's time to act. Because the next symptom we're about to uncover isn't about sensation at all, it's about what you can actually see. And once you do, it's hard to ignore. Symptom number 4. Blood in urine or semen. Seeing blood where it doesn't belong is one of the most alarming experiences any man can face. Whether it's in your urine or your semen, it's a symptom that instantly grabs your attention, and rightfully so. Blood in either of these fluids is not normal, especially for men over 60, and it can be one of the clearest signs that something is wrong deep within the prostate. When cancer begins to form in the prostate, it can irritate or rupture tiny blood vessels inside the gland or surrounding tissues. This leads to the presence of blood in your urinary or reproductive tract. Sometimes it's visible, bright red, or rust-colored. Other times, it's microscopic and only detectable through testing. But either way, it's a sign your body is sending that should never be ignored. The biggest mistake many men make is assuming it's just a result of strenuous activity, sexual activity, or a minor infection. They wait, hoping it goes away. And while sometimes it does, that brief pause in symptoms doesn't mean the underlying issue is gone. In fact, it may mean the cancer has settled in deeper, silently progressing. I've spoken with men who saw blood once and chose not to mention it for months. When they finally came in, the cancer had already moved beyond the prostate. The window for early treatment had closed. That's why this symptom is so important. If you ever see blood where it doesn't belong, even once, don't wait. Speak to your doctor immediately. And if you think that's serious, the next symptom may hit even closer to home because it affects something most men over 60 already worry about, but rarely connect to prostate cancer. Symptom number 5. Difficulty getting or maintaining an erection. Erectile dysfunction is something many men face as they age, and it's often brushed off as a natural part of getting older. But here's what most don't realize. When your ability to get or maintain an erection suddenly declines, especially if your desire remains intact, it might not be about aging at all. It might be a warning sign from your prostate. The prostate plays a crucial role in your sexual function. It sits near the nerves and blood vessels responsible for achieving an erection. When cancer begins to grow in the prostate, it can interfere with these vital pathways, reducing blood flow, compressing nerves, and disrupting the complex process that allows for a firm, lasting erection. Many men notice that things just aren't working the way they used to. They feel frustrated, confused, and sometimes even ashamed. But instead of getting help, they keep it to themselves, not realizing that this change might be more than just a bedroom issue. It could be the first sign of something much deeper. It's important to understand that not all erectile issues are caused by prostate cancer. Heart health, medications, hormone levels, and psychological factors can all play a role. But if this change comes on suddenly or worsens over time, especially when combined with other urinary or pelvic symptoms, it should never be ignored. Sexual health is a sensitive topic, but it's also a mirror into your overall health, especially your prostate. And sometimes what seems like a private issue is actually a public alarm from your body. If this symptom resonates with you, stay with me because the next one isn't about performance, it's about pain. And when it shows up, it may already mean the cancer has begun to spread. Symptom number 6. Pressure or pain in the lower back, hips, or thighs. If you've been living with persistent pain in your lower back, hips, or upper thighs, and it doesn't seem to go away with rest or medication, it might be more than just muscle strain or arthritis. For men over 60, this type of deep aching discomfort can sometimes signal something much more serious, especially when it's consistent, unexplained, and gradually intensifies. This is the kind of pain that doesn't come from lifting something heavy or sitting too long. It comes from within, and in some cases, it comes from prostate cancer that has spread beyond the gland. The prostate is located near the pelvic bones and spine. When cancer cells begin to break away and spread, what we call metastasis, they often travel to nearby bones, especially the lower back and hips. Once there, they can cause inflammation, pressure, and even small fractures that lead to chronic pain. Unfortunately, this kind of pain is often mistaken for aging joints or sciatica, and many men endure it without ever considering that their prostate might be the source. This is why it's so important to connect the dots. If you're experiencing back or pelvic pain that doesn't respond to traditional treatments and you're also dealing with any of the earlier symptoms we've discussed, frequent urination, weak stream, erectile changes, your body may be trying to tell you something far more urgent. Ignoring bone-related pain can allow cancer to spread unchecked, but recognizing it for what it truly is can be the key to catching prostate cancer before it moves even further. And speaking of subtle but serious changes, the next symptom we'll discuss is one you won't feel in your bones, but you'll see it in the mirror. Symptom number 7, unintentional weight loss and fatigue. When you begin to lose weight without trying, without changing your diet, without increasing your activity, it's time to pay close attention. For men over 60, unintentional weight loss is never something to ignore. It's one of the body's most important warning signs. And in the case of prostate cancer, it can mean that the disease is quietly taking hold. Prostate cancer, like many cancers, consumes a lot of the body's energy as it grows and spreads. It affects your metabolism, breaks down muscle, and often suppresses your appetite, all of which lead to weight loss that seems to come out of nowhere. You might notice that your clothes are looser, your face looks thinner, or your strength is fading even though your routines haven't changed. That's not just aging, that's your body being affected from the inside. Along with the weight loss comes fatigue, sometimes mild, but often deep and persistent. This isn't the kind of tiredness that goes away with a nap or a good night's sleep. It's the kind that lingers, making it harder to get through your day, leaving you feeling like you're running on empty. And when this exhaustion is paired with other prostate-related symptoms, it's a red flag that should never be ignored. Many men dismiss these signs as just getting older. But when your body starts shedding pounds and energy without explanation, it's your immune system waving a red flag. It's saying something's not right. And while this symptom might show up slowly, the final one we're about to cover is felt almost immediately. It's frustrating, it's relentless, and it can feel like your bladder is betraying you. Symptom number 8, feeling like you still have to urinate even right after going. Imagine finishing a trip to the bathroom, stepping away, and immediately feeling like you need to go again. That nagging sensation, like your bladder isn't truly empty, can be more than just annoying. It can be a direct signal that your prostate is interfering with the flow of your urinary system. For men over 60, this feeling of incomplete emptying is one of the most common and most frequently ignored symptoms of a prostate that may be enlarged or worse, affected by cancer. Here's why it happens. As the prostate grows or becomes infiltrated with cancerous cells, it can put pressure on the urethra, restricting the normal outflow of urine. Your bladder has to work harder to push through the blockage. Over time, this extra effort weakens the bladder muscles, leading to that constant sensation that something was left behind. You may find yourself going to the bathroom more often, standing there longer, and still feeling unsatisfied once you're done. This symptom tends to sneak in slowly, and because it doesn't cause pain, many men dismiss it. But over time, it can lead to more serious problems, bladder infections, kidney strain, and even permanent damage to your urinary system. And in the context of prostate cancer, it can be one of the earliest yet most easily overlooked signs that something serious is taking place. If this sounds familiar, don't ignore it. Your body is speaking to you clearly, calmly, and urgently. And now that you've heard all 8 of these important symptoms, you might be wondering, what should you actually do next? Well, in just a moment, I'll walk you through exactly how to take action and possibly improve your health. By now, you've heard the 8 most important symptoms of prostate cancer: frequent urination at night, a weak or interrupted stream, burning or pain during urination or ejaculation, blood in your urine or semen, difficulty with erections, pressure or pain in your back or hips, unexplained weight loss and fatigue, and that lingering feeling of not fully emptying your bladder. Individually, each of these may seem minor, perhaps just annoying, easy to explain away, but together they form a pattern that no man should ignore, especially not a man over 60. I've seen too many patients come in after months or even years of dismissing these signs only to discover the cancer had already spread. And I've also seen the relief and hope in men who caught it early, who took these symptoms seriously and acted quickly. You see, prostate cancer doesn't always arrive with obvious alarms. It often begins quietly, sending subtle, persistent signals that something's not quite right. That's why awareness is so important. It gives you the chance to take control before the disease takes control of you. So, here's what I encourage you to do. If any of these symptoms sound familiar, Even just one, don't wait. Make an appointment with your doctor. Ask for a PSA test. Have that conversation, even if it feels uncomfortable. Your health, your energy, your future may depend on it. And even if you're symptom-free today, stay informed, stay proactive, and take care of your health. Because when it comes to prostate cancer, early action is very important. Your body is communicating. The question now is, are you listening?